What if coronary artery disease, which is the #1 killer of men and women, isn't only treatable, but actually reversible? But most people believe that plaque only goes one direction. Worse. Today, you're going to see data suggesting reversal. This is not speculation. This is documented medical outcomes. You may never look at food the same way again. There is one part of the study that almost no one talks about, which is the number that stunned cardiologists. And I'm going to show you that number near the end. So stay with me. Don't forget to like and subscribe to this channel for more interesting health insights that you will not get anywhere else. So why does this study matter, which I'm talking about today? Well, coronary artery disease is labeled progressive, lifelong, and terminal by most medical expectations. But the paper argues that current surgical and medical management may manage symptoms without stopping disease progression. So if coronary artery disease progression can slow or even reverse under correct dietary conditions, this changes everything. So the big question is how does diet compare to stents and medication long term? We're going to get there, and the result may shock you. So let's start with the background, and let me show you the study right now so you don't miss it. So here's the study. This is the original research, a way to reverse coronary artery disease. And as you see on the screen, you'll see the abstract and the details there, okay? So this study was looking at plant-based nutrition and trying to arrest coronary artery disease and reversing it. And this was a small study. There was skepticism that this approach could succeed in a larger group of patients. And so the purpose of this follow-up study was to define the degree of adherence and outcomes of 198 consecutive patient volunteers who received counseling to convert from a usual diet to a plant-based nutrition. So it sounds pretty healthy, right? Plant-based nutrition. So they followed 198 consecutive patients counseled in plant-based nutrition. These patients with established cardiovascular disease were interested in transitioning to plant-based nutrition. So this is what we're talking about today. So of the 198 patients with coronary vascular disease, 177, which was 89%, were adherent. Major cardiac events were judged to be recurrent disease, totaled 1 stroke in the adherent cardiovascular participants. So there's this recurrent rates of 0.6%, which was significantly less than reported by other studies of plant-based nutrition therapy. Okay, what was the conclusion of the study? Well, I'm going to get there eventually, and I'm not going to show you that yet, but you can find the study later. I'm going to hold your interest for a little bit, okay? All right, so I've showed you a little bit about the study. So there was 198 patients. There was an average follow-up of 44 months or 3.5 years roughly. Previous studies to this were small. All of them had cardiovascular disease, the participants, and they had multiple comorbidities. The previous studies were small, as I said, and it left people skeptical of any potential change. This larger sample tests whether adherence was sustainable and clinically meaningful. So if people won't stick with the diet, even if it works, is it useful in the real world? That is not a question, right? And should we go plant-based? Well, let's look at what they actually ate. The diet was whole food, plant-centered. There was no oils, there was no dairy, there was no meat, there was no fish in the study, the individuals who ate. What was allowed in the study was whole grains, legumes, lentils, vegetables, fruits. There was some supplements which were given, which was B12 and a multivitamin. All added oils were removed, not just animal products. The vascular system, in the study of the individuals, the vascular system was shielded from fats known to injure endothelial lining. So why did they also avoid nuts, avocado, and caffeine? I'm going to unpack the inflammation link later here. So you want to hold on, you want to listen here. Adherence to this was shockingly high. There was 89% adherence rate over 3.7 years. But lifestyle modification studies normally fall apart over time. So something about education, something about accountability, and something about clarity empowered people's compliance. When people understand why, they often live differently. So truth applied, it becomes transformation. That's key. And so there's all kinds of things. Well, everyone's in a pursuit, and maybe not everyone, but many people are in pursuit of truth. They want to know how to take care of themselves the right way, truth. And so when people find out what works, often for them, that is their truth. And so when they apply that truth, it becomes transformative in their life. So we're looking at health truth applied to the life and leading to transformation. By the way, if you appreciate evidence-based, faith-aligned health research like this, hit subscribe because we go deep here. So Let's keep going. Out of these adherents, there was 21 who were non-adherent patients. 13 had major adverse outcomes, which was around 62% event rate. There was stroke, bypass, stents, cardiac health. All of this was looked at. 177 adherent patients. There was only one stroke attributed to disease progression, which I shared with you was that 0.6% recurrent event rate. There's all kinds of benefits for these people, but I'll get to that. This wasn't just some randomized trial. Critics will say that correlation does not equal causation. So I want to highlight to you, okay, that the comparant adherent versus non-adherent inside the same cohort was 0.6% versus 62%. So this is the highlight here. I don't want you to miss this. 0.6% versus 62%. So less than 1% versus 62%. So this is not coincidence, it's actually a pattern. This is the number that I teased earlier in the message here, okay? So I don't want you to miss that. That's not just, some off track or offshoot comparison. That's 1%, less than 1% versus 62%. So the plant-based diet clearly had a positive effect, and this was not just some coincidence. There was some causation here. What mechanisms explain what happened? When people had a plant-based diet, avoided those oils, what mechanisms explain what happened? Well, diet protects endothelial cells, so you have more nitric oxide, more arterial relaxation, and you have more healing. But high-fat meals create oxidative stress and vasoconstriction. So when the damaging stimulus is removed, those fats and the inflammatory meats, then the body can regenerate. Isn't that so cool? Our bodies, almost as if they had a divine creator, can regenerate themselves. So removing animal foods reduces TMAO production, which is a compound linked to atherosclerosis. Vegans do not produce TMAO because the gut biome changes. Can the microbiome itself shift disease risk? I'm going to circle back to that. So there's this before and after imaging that was shared. I'll go back to the study so you can see some more. Okay, let's go back. Also I want to share with you the significance, okay, of the findings. But I'll get to that anyways. Here's the pictures. So you on the screen, figure 1 and figure 2. So you have before the treatment, after the treatment. You see that? And you see the reversal in these images. So the coronary angiography reveals a diseased distal left anterior descending artery. Following 32 months of a plant-based nutrition intervention without cholesterol-lowering medication, the artery regained its normal configuration. That's here on the right. Isn't that incredible? This was a plant-based diet. That's pretty neat, isn't it? What are we going to do with this information? Do we care about it? Do we care? So PET scans showed blood flow returned to ischemic tissue in 3 weeks. Angiographic plaque regression was seen in multiple patients, but surgery, we're told, improved circulation instantly. But diet offers slower but deeper healing at the root cause. So what's the root cause again of CAD? It's inflammation and lipid deposition. When you have those two together, boom, you have CAD. So if you're still watching right now, then you're serious. So hit like to this video and share it so it reaches someone who needs to know this information. Heart disease mortality plummeted when meat supply vanished. What am I talking about? Well, I'm talking about Norway in World War II. So Norway in World War II, you had heart disease mortality plummeting when meat supply vanished. All of these plant-centered cultures, like in China or in the Papua New Guinea, in the highlands, all these plant-centered cultures, they have negligible coronary artery disease. There's something to be said about fat and meat and these things. Modern Western diets are now globalizing. Heart disease is globalizing too. Isn't that interesting? Western diets, heavily processed, lots of meat. So what are the practical takeaways from the study that I'm highlighting? Well, swap oil for water or broth sautéing. Base meals on beans, greens, grains, and fruit. Remove or sharply limit animal fats and animal foods. Avoid refined sugar and processed fats. Discipline is hard without vision. So I'm sharing with you a vision. Think of food as fuel, not comfort. Comment below what's one change that you could start this week. But there's this twist I want to share with you. It's the microbiome twist. Gut bacteria adapt to diet. Carnitine and lecithin in animal foods create TMAO only if the bacteria exist to metabolize it. But when animal foods are removed, the bacteria die off. So the body becomes biologically resistant to plaque. This isn't just diet, it's internal ecosystem remodeling. There are limitations to this, so I have to be fair and balanced with this study. If you want to see the study, I'll pull it up again. This is it here, okay? So you see, the proof is in the pudding, so to speak. You see those images, right? This is the research, a way to reverse CAD, question mark. I think we've seen the way to reverse it, or at least help to reverse it, right? So limitations, let's apply some balance. They're self-selected, motivated participants. There was no control group, there was no randomization. But the effect size is so massive that it cannot be ignored. Less than 1% versus 62%? There is causation here. The paper concludes that randomized trials should be pursued now. And looking forward to seeing more of those. So what's the point of all this? Okay, you're watching this for the first time, you're like, okay, I get it, Ben. What's the point? The point is that you are not powerless against disease. The body is designed for restoration when obstacles are removed. But knowing isn't enough, so you have to act. Every bite you take moves you toward life or toward disease. So I tell you today, choose life. If this has helped you reconsider what's possible, subscribe to this channel for more content like this. This is real research, real hope, real change for you. So share this video with someone who needs encouragement today. Again, this is Study-Wise Health with Benjamin Fagan. I love health science. I love anything that helps me get healthier and helps others get healthier. If you can support my work, please do so. Share this video with someone who needs encouragement today. May you be blessed as you follow on to know true and good health principles for your life.